normally we go back and forth. I have to be here anyway, so I'm going to let Hickenlooper go before me.
Thank you, Mr. Chair. Dr. Christine, Secretary Kennedy announced that he had plans for the department to mine, quote unquote, extract and utilize the data from Medicare and Medicaid claims to inform his investigation into the causes of autism. Now, this database would include information from wearable devices like an Apple Watch or an Oura Ring, things like that. Now, as a physician, and obviously I think you obviously understand the value of personal health privacy, does this concern you?
So, Senator, number one, thank you for being here, sir. I'm sorry we didn't have the chance to meet. You know, in terms of pursuing the Make America Healthy agenda, we know that the Secretary is absolutely committed to doing that, to collecting data and operating from a position of science. I have not spoken to the Secretary or heard specifically his thoughts about the wearable devices, and I would want to do that before I make comment. And if confirmed, I commit to you that I would certainly have that discussion and be happy to discuss that with you again.
Sure, and make a commitment to ensure that the database and all these other collection efforts at the HHS uphold the highest levels of privacy.
Well, we absolutely want to respect patients' privacy, and we absolutely want to pursue the ending of chronic diseases.
Great, thank you. Ms. Carey, the President's budget request proposed cutting NLRB by $14 million, roughly 5% of the budget. Now, according to the agency's budget plan, NLRB said it will lose almost 100 employees in the next fiscal year through buyouts and early retirements. Are you worried these cuts are going to, obviously they include the General Counsel's office, so are they going to impact the ability for the board to really do its job effectively?
Thank you for the question. One of the things that I want to do, and I've discussed a couple of times, is I want to make sure that there's a full organizational assessment performed for both the field and headquarters to ensure that staffing is appropriately used so that we can respond to cases in a timely manner. So while I wasn't privy to what the background was on how they got those numbers or where they landed, I look forward to, if confirmed, working with the agency to ensure that we're properly staffed.
Okay, fair enough. Dr. Christine, HHS has released an updated guidance on the eligibility for the COVID-19 vaccine. Some groups of individuals who've previously been covered now will not be covered, or likely will not be covered. And this has caused a significant level of concern between patients and providers as to which vaccines would be covered by insurance and who might be forced to pay out of pocket for those costs. So are you concerned that this is going to require physician offices to do, even more administrative, burdensome work to figure out who has coverage, who doesn't, while at the same time doing all the things you've got to do, provide medical advice, make sure you're taking care of that patient?
Sure, Senator, thank you so much for that question. Secretary Kennedy has always been clear, and he believes we need to follow the science when it comes to any kind of medical therapy, and that would apply to vaccines and to immunizations. Regarding what is recommended or what is on the schedule, we know that science is not static. Science is dynamic. It can change over time, and certainly the Secretary wants us to be able, if science in the future and data leads us down the road where we need to make changes to the schedule, for instance, that we'd be willing to pivot and do that if science leads us in that direction. We always want to be responsible to do that. In terms of coverage of the vaccines, of course, what's recommended is going to be covered, but we have to be able to pivot. We have to be able to change if we find a need to do so in the future.
And how do you look at, when you say science directs us, when there's a disagreement within the scientific establishment, how do you look at distilling out what it is that science is telling you?
Yes, I think that's an excellent question. Thank you. One of the hallmarks of data that can be trusted or believed is reproducibility. And certainly Dr. Bhattacharya spoke to this during his hearing, that if there is, let's say, two sets of data that may not agree 100%, we have to have reproducibility. In other words, We can always do more studies, more science to try to figure out what is reproducible and what is actually true. And that's probably the best way to figure out what the right answer is.
Well, certainly part of it. That's excuse me, part of a longer discussion. Probably need some medical assistance.
Well, I'm a urologist. I can't help with a cough. I'm sorry about that.
I appreciate that. I yield back to the chair.